Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the surface anatomy of the parotid gland and the parotid duct. The parotid glands are a pair of serous salivary glands. These are the largest salivary glands, and the parotid duct is the duct of the parotid gland, also called Stenson duct. Points to outline the parotid glands. We have the anterior border. We'll go to the anterior border. Okay, so anterior border, a point at the upper border of the mandibular condyle. Okay, a point at the upper border of the mandibular condyle. Number two, a point just above the center of the masseter muscle. Okay, number three point, a point below and behind the angle of the mandible. So if you outline these 3 points together, then we'll get the anterior border. How can you identify the mandibular condyle? If you ask the patient to open the mouth, if you palpate the temporomandibular joint area in front of the tragus, you'll find out the upper border of the mandibular condyle. How can you identify the masseter muscle? If you ask the patient to clench the teeth, then the masseter muscle will be prominent and taut. We can get the point at the center, just above the center of the masseter muscle. Okay. Then superior border is a curved line below the external auditory meatus across the lobule of the ear. Points to the, what are the points? A point at the superior border of the mandibular condyle. Second point at the upper part of the anterior border of the mastoid process. So it goes like that way. Okay, like this way. We got that. Now go to the posterior border. Points to outline the posterior border. A point at the apex of the mastoid process. Okay, here. Number two, a point below and behind the angle of the mandible. We got the posterior border. Okay. Now we'll find out the surface anatomy of the parotid duct. Points to outline the parotid duct. A point at the lower border of the tragus of the external ear. This is the tragus, this is the lower border of the external ear. A point between the ala of the nose and the red margin of the upper lip. The middle third of the line joining these 2 points represents the parotid duct. If you go to our first image, okay, then we'll get the outline. Okay, suppose this is the tragus of the external ear. This is one point. If you go to that point, okay, this is one of the point here. Another point, the red margin of the upper lip for the parotid duct is the ala of the nose. So our point in between, it should be here. And if we draw a line from here up to that, the middle third will represent the parotid duct, the middle third. So from the lower border of the tragus to the midway between the ala of the nose and the red margin of the upper lip, this is the midpoint area. And if we draw a line, middle third will be the parotid duct. Okay, we got that. That is the parotid duct area. Okay. Okay, so we got the parotid duct. Now we go to the, we have gone through the duct border. Okay, and where does the parotid duct opens? It opens inside the vestibule of the mouth against the Here is the crown of the upper second molar teeth. What is vestibule of the mouth? Vestibule of the mouth is the space between the teeth behind and the lip and the cheek in front. The space between the lip cheek on one side and the teeth on other side is the vestibule of the mouth. Okay, we got that. So before going there, here is important. What structures are crossed by the parotid duct? Parotid duct crosses the masseter muscle. This is the masseter muscle. It does not pierce the masseter muscle. It pierces the buccal pad of fat, buccopharyngeal fascia, buccinator muscle, and mucous membrane. Okay. So these are the objective question. What is the largest salivary gland of the body? This is the parotid gland. We have one pair of parotid glands. How the capsule of the parotid gland is formed? By the investing layer of deep cervical fascia. What type of acini are found in the parotid gland? Answer should be the serous acini. What structures are present in the parotid gland? We have the retromandibular vein formation, termination of the external carotid artery, and branches of the facial nerve. Plus, we'll get some lymph node. Okay. What structures are pierced by parotid duct? We have the buccal pad of fat, buccopharyngeal fascia, buccinator muscle, mucous membrane. Where does the parotid duct open? In the vestibule of the mouth, at the level of the crown of the upper second molar teeth. Okay, what is the lymphatic drainage of the parotid gland? Answer should be the parotid lymph node, then to the deep cervical lymph node. What is the developmental origin of the parotid gland and parotid duct? Both gland and duct are coming from the ectoderm. Okay, and these are my references. Okay, so if you have any question, please feel free to ask me. Okay, and please share the information with your friends, and certainly please practice on the living person, and please support my channel. Please subscribe me. Have a nice day. Bye now.